We want to continue with the story of COVID-19 and what happens once you get the virus. Our next guest says that her life has turned completely upside down since she was first clinically diagnosed with COVID-19 back in May. And she says that she still is suffering with numerous physical and neurological symptoms brought on by the virus, even all these months later. Ruth Castellanos, thank you so much for joining us and talking about what you've been through today.
Thank you so much for having me.
Let's talk about when you first got sick and what happened to you and what that initial situation was like for you.
So I started with a fever, and I hadn't had a fever in years, so that was very odd for me. And then I had a lot of shortness of breath, and that just really worried me. And a couple of days after, I started with a cough, and I just thought, oh my goodness, do I have this? And I had a fever for about 7 days. I had a really bad cough. There were a couple of times where I thought I wasn't going to make it. I thought my husband was going to find me dead. Actually, I couldn't breathe at all. It was horrible. And after I was finished with the acute phase, I thought, okay, I'm going to get better. And, people are a little bit sore after, they get sick, so I'll just get better. And actually, I just got worse. I started getting a lot of neurological issues, horrible muscles and joint pain where everything was throbbing, migraines, tremors. I wasn't even able to hold a glass of water. And it was just so concerning. I had no idea what was happening. So for me, the after effects of it has been worse than the acute phase.
What do you mean by that the after effects have been worse?
So it set me off to have neurological issues, gastrointestinal issues, the muscle and joint as well, cardiac. I'm still short of breath. My pulmonary tests seem okay, but I'm still short of breath all the time. I haven't been able to, return to work, to do even 40% of what I used to do before. I was so active. I was so happy-go-lucky, and it has really just changed my whole entire life.
Are you in physical pain or discomfort?
All day, every day. Yes, I am. From top to bottom.
And what can you do about that?
I'm on medication for pain, for the autonomic nervous system, because I guess it got dysregulated. I'm on heart medication. I'm on many different supplements. Also trying to boost my immune system because it got wiped. And I'm just on so many things. I'm on IV therapy as well. I'm trying everything that I can possibly try to just get better and just make it, through the days. And every day is different. And I have no foresight on how tomorrow is actually going to be either.
Ruth, how many specialists are you seeing?
Between specialists and doctors, I'm seeing about 10.
How often are you going to a doctor or a specialist?
Right now, it seems like I'm seeing somebody once a week, actually. I'm having to get a lot of tests done. And if it's not a test, then it's a doctor or a follow-up or some lab work. It's just basically once a week I'm seeing somebody.
Did you have any underlying health conditions prior to COVID?
I have hypermobility syndrome. However, that doesn't cause you, everyday pain, or you're not immunocompromised because of it. I do have an allergy to the cold. So that is an autoimmune disorder. However, it didn't affect me every day or even every month at all. Only in the winter months and sometimes. So I was very healthy. I was very active. I was actually saying all the time, I'm in the best health of my life. I was gardening for like 5 hours a day, walking dogs, working, cooking, painting, and I can't do any of that right now.
You mentioned that you're married. I hope you don't mind me asking, do you have children?
I don't.
What impact has this had on your relationship with your partner, with the people in your life?
My husband is working, all the time, and then he comes home and does so much more at home, cooks, cleans, picks up the slack for what I can't do. It takes, two of us to have our property and have our house, and I was always so happy to do everything. We're partners. However, right now he's having to do mostly everything. And there's days that, yes, I'm home and I should be able to cook and clean and, do the things that you just do on a daily basis. But there's just sometimes that I just can't. So he's doing a lot. And the relationships with my friends, right now they're all virtual, right? But they're there. They're lovely. They're always asking how I'm doing. My family as well, my mom, my sister, my in-laws, they're always checking up on me. But it's just us two here with our dog, and he works, and so it's just me and my puppy.
You've described incredibly vividly the physical toll this has taken on you. Can you help me understand psychologically, emotionally, the toll these past 7 months have taken?
I think coming into this illness, I was in a very good mental and emotional state, had self-confidence and all those things. And I think if I didn't have that as strong as I did, then I wouldn't be coping the way that I am right now. However, it is very difficult. I'm getting diagnosis. I'm constantly going for tests. Some tests relapse me because of the physical exertion that they need for me to do these tests. And it becomes overwhelming. I have a book and a binder of all the things that have been going on, all my labs, all my reports, because I'm constantly giving them to all the other, health professionals that I'm seeing. So that alone is a lot to keep track of. And I'm having neurological issues. So something that takes me, 15 minutes or would have taken me now is taking me 45 minutes, an hour to figure out. So
because you're, forgive me, because you're just not processing information as quickly. Like, why is it taking you so much longer?
I'm not processing information as quickly. Cognitively, I feel like I've declined. I hope it's not permanent. Understanding information, sometimes memory. There's just sometimes that I'm even forgetting my first language, forgetting how to write it, and even just reading, even in English, it doesn't matter. I'm just like, what did that just say? Like, what does that mean? And I know what it means, but I just can't seem to comprehend it sometimes. It's really odd and it's scary. And I obviously don't want to be like this forever. And I know if I am, then I need to kind of try to figure that out. But I'm not worried about that right now. I'm taking it day by day.
Ruth, someone is still going to watch this interview, have heard everything you said, and still say, I'm not worried. It's not going to come to me. I'm going to go out. I'm not going to abide by the measures. I'm not going to obey the curfews. People who get it are, they're victims of a virus. But those who are intentionally breaking the public health orders and don't take the virus seriously, what would you like to say to them?
You're not immune. You're not. It doesn't matter if you're a child, if you're an adult, if you're a senior, if you're healthy, if you have underlying conditions. It does not matter. You are not immune. And if you do happen to get this and it's mild, and you break rules or you're asymptomatic, you can spread it to somebody who is healthy or who is ill already, and you're going to infect them and change their life forever, because they can end up with long-term effects like I am. And I don't wish anyone to be in the position that I'm in. Please just be mindful, follow protocols. Even if you don't believe this is real, do it for someone else and not just for yourself.
What's your hope for the next year? You hope that this is not permanent, the damage that's been done to your body. What are your specialists telling you?
At this moment, they don't know. They have no idea. Nobody knows. I have no answers for the long run. They're just treating my symptoms. They're treating what they know. I'm working with a team that is really worried about me and other long haulers, and they're keeping up to date, which is great. But I had to go and find those people. I had to fight for that kind of healthcare, so it didn't come easy. But they're telling me, we're not going to give up on you. We're going to try everything we can to get you better. And aside from that, that's all they can say.
Okay. We wish you the very best. I cannot thank you enough. I'm sorry that you're going through this, but I appreciate so much that you would share these experiences, and I hope that it'll help other people. And if anybody else is hurting the way you're hurting, they don't feel so isolated. So Ruth, thank you so much.
You're welcome, and thank you for having me, and thank you for putting these stories out there because they're needed. And for those of you guys who are suffering like myself, you're not alone.
Ruth, you know what? Let's keep in touch. Tell us how the journey's going, and hopefully very soon we'll speak to you when everything is good and in fighting form and you're back 100%. Does that sound good to you?
Yes, thank you so much.
You're welcome. Ruth Castellanos has been experiencing her COVID-19 symptoms since May of 2020.